Hi everyone, Danielle here from the Obstacle Doc, and today we're going to be talking about adductor or groin strains and pains. So when we talk about this kind of groin strain or pain, we're specifically talking about the adductor magnus because of the different functions that it does. So your adductor sits on the inside of the leg. There's a group of them, but this one in particular has a hamstring component, which is why it has a couple of different uniquities. It does, in addition to strict adduction, which is bringing the leg in closer to each or to one another, it also can do hip flexion from extension. So if you're in an extended position, it'll help in coming forward. And if you're in a flex position, it can also help in extending your hip back. So when we hear about groin pain, strains, adductor groin pain, strains, usually this is with repetitive motion. So running, lots of walking, maybe stairs, maybe biking. And what we're thinking about those is that this is a pretty single plane motion, right? When you're running, you're coming through forward and backwards. When you're biking, same thing with walking, same thing with stairs. And the way I like to have people picture this is that usually when you're on a bike, you're not kind of turning out like this. You're probably not running in this kind of funky frog leg position, which would be where the adductor would be assisting through. So when we look at these strains, while we want to target the tissue specifically and see what we can do to calm it down, see where it is as far as resting tone, if there's high tension, low tension, any weakness, any strain deficits, we also need to look more globally because this is a compensatory pattern to the rest of the hips musculature. So like I said, if it needs to be used to help in hip extension, maybe because our glutes aren't firing as much as we want them to be, or if it needs to be a useful tool for hip flexion, maybe because our iliopsoas muscles, our quads are not doing as much as they can in this forward movement. That's why we'll take a global approach, make sure that there's no missing pieces of the puzzle, and make sure that if we're doing a single leg squat test, we're not starting to fall into these funky patterns which progress into other different mechanisms of injury.